Hi, my name is Dr. Josh Waltzman. I'm a board-certified plastic surgeon, and in this video, we're gonna talk about all things mommy makeover. Having children, being pregnant, it really puts the body through a lot of changes. And so this surgery is meant to kind of turn back the clock and reestablish that pre-baby body for all those women out there. There's a lot of different combinations of what can constitute a mommy makeover, but typically it is something to rejuvenate the breasts and something to rejuvenate the abdomen or the midsection. You certainly don't have to be a mommy to have a mommy makeover. We have a good number of women in our practice who are getting these combinations of procedures that have never had children before. And there's a lot of changes that are very similar just as we age. Gravity works on all parts of the body. So oftentimes as women age, their breasts do descend a little bit on their chest, and which could require doing a breast lift. The whole process for mommy makeover is similar to other surgeries in the sense that you will call our office and speak with our patient coordinator, who will gather a lot of information from you about what you're looking to achieve with your surgery. That's then followed by an in-person visit to our office where you'll sit down with myself and we will go through all of your goals again. Once we're ready to proceed with surgery, it's about finding a date. Once we have a date for our procedure, we usually see you a few weeks before that for a preoperative consultation here in the office where we review the entire plan for your surgery. We go through all the necessary consent documentation. We take all of our preoperative photos at that visit, and really it's a way to plan out and solidify the plan for your surgery. On the actual day of surgery, you'll arrive to our surgery center about an hour or so before your planned procedure time. You'll meet the rest of the entire OR staff and team, including the anesthesiologist and the nursing staff. We then bring you into our surgical suite for your procedure. Following that, you are brought to our recovery suite where you will recover for anywhere between 1 and 3 hours for a procedure like this. And then you'll have a friend or family pick you up and take you home that night to recover. That night, I do call you at your house, check up on you personally to make sure that you're doing okay, and answer any questions you might have that first night after having your mommy makeover surgery. And then we see you back here in the office a couple days later for your first post-op check, followed by a lot of routine post-op checks during the healing process. If I think I can safely accomplish the patient's goals in one surgery, I am more than happy to do that. But if I think they're gonna get the best results possible, separating surgeries into 2 stages, then I will always recommend that for a patient. But I would say most of the time we're able to accommodate in 1 round of surgery. The best candidate for a mommy makeover is someone who is otherwise in pretty good health. They're active, they live an active lifestyle, they have a nice, healthy, balanced diet, and they're a non-smoker. People who are not good candidates for a mommy makeover are those patients who are still considering maybe another child in a year or 2. I really caution and recommend waiting. Additionally, you want to make sure that you've stopped breastfeeding for at least 3 to 6 months before having any surgery like this. Otherwise, there's just too many changes going on in a woman's body, and there could be changes after surgery, which actually could end up with a less than ideal result. If you're doing this for the right reasons, for you and not for someone else always, and to feel better and more confident about yourself, then this is a fantastic transformative operation. Yes, it is surgery. There's risks associated with every surgery, but as long as you are healthy and we've determined that you're of minimal risk for this procedure, it is a very safe thing to undergo, and it really does help restore confidence for these women and allows them physically to sometimes even do more than they were able to do before the procedure. So we realize this is a really important procedure for a lot of women, and because of that, I take it really seriously. And I am very honest with my patients that come in talking about mommy makeover, about what's realistic, what's not realistic for them. And I will tell patients sometimes, I don't think you're a good candidate for this, or I don't think you should do this procedure because of X, Y, and Z. Instead, let's focus on this, and this is what's gonna get you to accomplish the goals that you're looking for. If you think that a mommy makeover might be the right procedure for you, the next step you need to take is to call our office, talk with one of our patient care coordinators, and then schedule an in-person consultation to sit down with me so I can really talk to you about your goals and find out if this is the right option for you.